Justin, flu season is almost here, and even now, students are beginning to cough and sniffle.
And this year, for the first time ever, doctors are recommending that all children get a flu shot. Shay Patel has a story.
Say hello to Nicholas. This little boy is about to get a flu shot as his sister Katrina looks on. But this year, it's not just children who should get inoculated. For the first time ever, the Centers for Disease Control and Prevention is recommending that all minors aged 6 months to 18 years old get a flu shot. Dr. Pratibha Deshmukh practices in Totowa and has been a pediatrician for 30 years. She explains the new policy.
Before we had mandatory was of 6 months to 2 years. Now mandatory is from 6 months to about 6 years. But the recommendation is for everybody, and specifically from 6 months to 18 years. It's highly recommended. That is because that is the population who is more in touch with the society. The children are the one which are being taken care of, the parents, grandparents. They are the one who are in the family, society going. They are the one who bring the infection, and they are the one which spread in the population, who spread the infection in the population. So if you prevent it at their level, it will be prevented in the whole community. Why they're going above up to 18 years? Because even teenagers are at risk. They may not be practicing good hygiene, or they may be sharing things with others. And in general, they are out, they are being exposed to this, so they are at risk.
So now that we have established who should get a flu shot, let's find out exactly what is the flu and how you can recognize it.
Okay, the flu infection itself is caused by a flu virus. Influenza virus type 1, type A, type B, or parainfluenza viruses. It can affect everybody, and it can cause mild cold-like symptoms, mild flu, and then complicated flu. Mild symptoms could be just the cold, headache, body ache, and mild fever. They could get much severe picture or much more prominent picture, like they will have chills, high fever, headaches, body aches, weakness, they may have cough, they may get pneumonias. They're very prone to pneumonias with flu. Those who have other illnesses with it, like diabetes, sickle cell, anything, they may get much sicker. They may, and the illness may for longer time. It may last for 2 weeks, 3 weeks. They could be coughing.
Dr. Deshmukh explains that while a flu shot does not guarantee you won't get the flu, the shot can significantly diminish the severity of the symptoms and the duration of the illness. The flu shot is effective, and if you are not ill, then you won't pass on your infection to others. As with any medicine, there is the potential for side effects, some of which are rare.
They could get side effects. They could get flu-like symptoms. They could get headache, body ache, fever, and they could be sick for 2 or 3 days. Compared to the flu, when they really get it, they could be sick for 7 days to 2 weeks also. It can linger. So the side effects are these. Very rarely there's another side effect. I don't want to scare the population, but it is known that sometimes it causes neurological problem, which also, like, they feel pains, aches, weakness, they can't walk and all that. That's a neurological problem, and they do recover from it. It's not like it causes permanent damage. So this is from the shot itself. I haven't seen it in my last probably 20 years. I have seen one kid who got it. But rest of them, yes, you can get fevers and headaches and all that. So that's the downside. My advice to all the parents is you should look into it. If the younger the kid, please make sure that they get the flu shots. They have to be more than 6 months. They should not have egg allergy, and they should get the flu shot. And now I'm talking about flu shot, but there's another flu vaccine available which is given in the nose. And that is for those who don't have asthma. Those are just the drops, and that can be given so the kid does not get a needle or the injection. So that's another thing. They should look into it, find it out. And yes, it's better to have all the kids so the whole society is safe. We will really avoid spreading the infection if we can immunize all of them.
So now it's time to get immunized. Consult with your doctor to see if the flu shot is right for you and your children. Shay Patel, TBN.